Arrhythmia treatment in Waco TX. Arrhythmia is the improper beating or rhythm of the heart. It is a condition whereby the heart beats very fast, too slow, or irregularly. Arrhythmias occur when the electrical signals that coordinate the beating of the heart don't work properly. Symptoms of arrhythmia. Symptoms of arrhythmia may include first, heart palpitations, second, a fast heartbeat, third, a slow heartbeat, fourth, chest pain, shortness of breath. Causes of arrhythmia. The heart's rhythm or beat is controlled by a natural pacemaker called the sinus node, which is located in the right upper chamber. The electrical signals that start each heartbeat are sent by the sinus node. These electrical signals move across the atria and cause the heart muscles to contract and pump blood into the ventricles. Diagnosis of arrhythmia. A physical exam will be conducted and your medical history will also be reviewed. Tests that may be conducted include first, echocardiogram. The echocardiogram test uses sound waves to produce images of the size of the heart, structure and rhythm. Second, implantable loop recorder. This test involves planting an event records the heart's electrical activity and also detects irregular heart rhythms. Third, event recorder. This test involves wearing an event recorder that detects and records irregular arrhythmias. Fourth, electrocardiogram. This test detects the electrical activity of the heart and measures the timing and duration of each electrical rhythm. Fifth, stress test. Some arrhythmias are triggered by activity or exercise. During a stress test, you will be made to ride on a stationary bike or run on a treadmill to increase your heart rate. Treatment of arrhythmia. Arrhythmia treatment depends on whether you have fast heartbeats, slow heartbeats, or irregular heartbeats. First, anti-arrhythmic drugs. These drugs are used to convert the arrhythmia to a normal rhythm. They can also be used to prevent arrhythmia. Second, heart rate control drugs. These drugs are used to control the heart rate and restore normal heart rhythm. Anticoagulant and antiplatelet therapy. These drugs such as warfarin and aspirin are used to prevent blood clots. Third, cardioversion. Cardioversion is used to reset the heart rhythm. It involves delivering a shock into your heart through paddles or patches on your chest. Fourth, vagal maneuvers. This therapy is usually used for fast heartbeats. It involves maneuvers of your breathing or coughing to control your heartbeat. Fifth, pacemaker. Pacemaker involves implanting a pacemaker that sends out electrical impulses that stimulate the heart to beat at a normal rhythm. Sixth, catheter ablation. This procedure involves threading one or more catheters through the blood vessels to the heart. Seventh, maze procedure. This procedure involves making a series of incisions in your heart tissue at the upper half of your heart to create a pattern of scar tissue. Eighth, implantable cardioverter defibrillator. This procedure involves implanting a cardioverter defibrillator under the skin near the collarbone. Electrode tip wires from the ICD are passed through your veins to your heart. Risk of arrhythmia. Certain conditions or factors can cause or increase the risk of arrhythmia. These include first, coronary artery disease, second, diabetes, third, high blood pressure, fourth, overactive thyroid gland, fifth, underactive thyroid gland, sixth, changes in the heart muscle, seventh, sleep apnea, ninth, changes in the heart muscle, 10th, valve disorder, 11th, congenital heart disease, 12th, electrolyte imbalance. If you want more details, please do watch www.lonestarheartandwellness.com.